Good afternoon. I often like to start with, how many cases are going on globally, and I think it helps us think about what's happening here, but also reminds us that it's such a global situation. There are about 1.7 million cases in the world and over 103,000 deaths. And in the country, there are over 22,000 cases, and last I looked, 569 deaths. Although there are no new positive cases to announce today for P.E.I, we have received over 129 negative tests back since Thursday. So it keeps our COVID-19 positive cases to 25, but no new cases today. We've done close to 1,800 tests on P.E.I, and our testing per million, which is how we compare to the other provinces, is slightly higher than the national average. As we've previously mentioned, our ground search and rescue is out at some of the provincial parks starting today, tomorrow, and Monday to help with our ongoing messaging around physical distancing as people may be out getting some fresh air. I know today the stores may be busy and there are more cars on the road. I'd like to remind Islanders that there should be a designated member of the household running out for essential items. And when you are in the stores, practicing physical distancing for yourself, other shoppers, and the staff. This weekend is an important weekend for us to continue to stay the course. For many of us, Easter traditionally means getting together with family and friends, and this year will be different, and it is hard. We've had some questions about whether or not extended family dinners are distancing when you need to go out, washing your hands, all those things we continue to say. If we follow these measures now, we have a chance to make a real difference in the weeks ahead. And I think the great work that people have been doing in P.E.I, the incredible hard work that we've been talking about, it is having an impact, and a really good impact on the province. What we are starting to talk about and think about is how and when we can ease up on some of these public health restrictions. It's not time yet, but I know we will all want to get there, and we will together. Thank you. Au Canada, aujourd'hui, il y a plus de 22 000 cas de COVID-19 et à peu près 600 morts. Heureusement, il n'y en a pas de nouveaux cas aujourd'hui ici à l'île du Prince-Édouard, et nous avons reçu le résultat de 129 tests depuis jeudi. Ils sont tous négatifs. On voit aujourd'hui beaucoup de gens dehors, au magasin, sur les routes. N'oubliez pas que seulement une personne par maison devrait être nommée pour faire les courses. Et quand vous êtes au magasin, suivez les flèches sur le plancher et respectez les 2 mètres entre vous, les autres personnes et les travailleurs. Cette fin de semaine de Pâques, c'est normalement un temps de s'unir en famille, mais cette année, on doit le faire d'une autre façon et je sais que c'est dur. On m'a posé la question si c'est correct de recevoir la famille cette fin de semaine pour Pâques. Si les personnes habitent avec vous, oui. S'ils doivent se déplacer d'une autre maison pour souper, non. Mais vous pouvez vous connecter pareil, appeler, branchez-vous pour une vidéoconférence, par exemple. Ce n'est pas facile, mais ça va bien aller. Je voudrais répéter comment sérieux que c'est le COVID-19. On ne voit pas de nouveaux cas, mais ce ne veut pas dire qu'on est sorti de l'auberge. Je m'attends toujours à de nouveaux cas et des cas qui pourraient se rendre à l'hôpital. C'est pourquoi on travaille si fort à réduire la propagation de cette maladie maintenant. Je vous remercie à chaque insulaire parce que vous faites tellement leur part pour aider la population ici à l'île du Prince-Édouard. Et je demande à chaque insulaire de continuer à faire leur part. Restez chez vous, isolez-vous après voyage à l'extérieur de la province et respectez la distance physique. On a la chance maintenant de vraiment changer le futur. Suivons ces mesures importantes pour qu'on puisse revenir à la norme. Merci.
Good afternoon. As Dr. Morrison said, now is not the time to relax any public health measures. Our public health and primary care staff and the hospital health care providers are not relaxing in our preparedness and in the response to the pandemic. We continue to provide the cough and fever and testing clinics. We're evaluating the current situation every day and continuing our planning and making adjustments as to further improve our preparedness. The cough and fever clinics are running 7 days a week and will be available for you all weekend as well. On Friday, 69 patients were seen in Charlottetown and 30 in Summerside. And just to remind people that these appointments for the clinic are available through referral from your family doctor, nurse practitioner, or through calling 811, and they are for anyone who has any symptoms of COVID-19. When arriving at the clinic, we remind you to remain in your vehicle until you're asked by the staff to come inside so we can follow our infection control guidelines. Our virtual care platform has been continued to roll out, and as of this morning, we have 36 healthcare providers who've registered with the platform, and they're learning the platform and will be using this in the coming days to provide care to patients. Just a final reminder as well that we do continue to offer essential services and emergency service as well as primary care services and home care to people. So please continue to call ahead for your appointments. Come to the emergency departments or clinics if you do need care, and make sure you're doing what you can to follow up on your ongoing health conditions. That is very important as well. And we want to say thank you from the healthcare system for keeping our cases this low by following the public health measures. And we feel fortunate to still be in this situation today, and we hope it continues. We're prepared if it doesn't, but we do want to ask you to please continue physical distancing, staying at home, only going out for essential services, and enjoy the Easter weekend with your family and in your household. Thank you.
Happy to take some questions.
Sarah Fraser, CBC.
Sarah.
Hi, Dr. Morrison. Are police forces or other enforcement officers or agencies now pulling over or stopping islanders to ask if they're essential workers and they need to be going somewhere?
So the highway safety is certainly asking people when they're coming on to the island. But as far as I know, they are not just randomly pulling people over as they're driving to ask them if they're essential. If I understood the question.
Okay, follow-up question. As regards the physical distancing, you mentioned that members of Ground Search and Rescue are out talking with people this weekend in provincial parks. Can you give us some more details on that? Can they issue fines? How many are they? Which parks? That kind of thing?
So I don't know exactly how many. The offer really was made through the Emergency Measures Organization, and it was a result of concerns that we heard from the public about a number of people who were at the parks who may not have been physically distant, and of course that's difficult sometimes to tell because a family unit may be out walking together, which is different than having other groups there. So it really is not intended to be their presence isn't intended to be there for issuing fines, but more just to reinforce the education message. If they run into situations where there may be too many people gathered, they will be calling enforcement to follow up and assist them. So it's really in those situations. We've said right along that by far the majority, Islanders are really trying to do their very best and have done an incredible job at learning how to be physically distant and trying to protect themselves and their families and their community. And education has been a big part of that. So that's really the first part of this, and it's continued to be a part for the last month.
Thank you.
Jessica Dory Brown, CBC.
Hi there, this is a question for Marion Dowling. I'm just hoping you could confirm that those 26 ventilators that were designated for P.E.I. have been rerouted, and just what the plan is in terms of the ongoing assessment of the need for that type of ventilator here on the island.
Hi. Yes, so I spoke a little bit about this on Thursday, I think it was, that we have heard from the National Emergency Stockpile. We had an offer for those additional ventilators, quite a number of them, back at the end of March. And now, as the situation has evolved across the country, they're prioritizing where the needs are with respect to hospitalized patients and patients potentially needing ventilators. So we have not received any of those yet, but from what I understand today, we have gotten some information from them that at least 10 of those will be coming our way soon and are getting prepared to be shipped to us. So they have not arrived yet, but we now understand that at least will be our initial support from that group, and they know what else we are looking for, which includes the 15 that we were looking to purchase through the federal government bulk purchase order, and we have 12 on order from our regular vendor that we expect delivery of within the next month or so.
Okay, thank you. And just a quick question for Dr. Morrison. Can you confirm how many people we have at this point recovered? Is that number still 17, or has that changed?
I believe it is still 17, and I'll have a further update on Monday when we're back talking to you again.
Okay, thank you.
Mike Robar, The Guardian.
Good afternoon to you both. I've got a question for Dr. Morrison. You mentioned it was about 2 weeks ago now, it'll be 2 weeks on Tuesday, I think, when you first announced when you hope to have our testing completely up and running. So is the plan still to be able to do all of our testing come this Tuesday?
It's a good question. So our capacity certainly has increased. So I think we've been talking about it over the so last weekend we started doing our local testing here. That continues. We now have the capacity to do quite a bit more here. So we went from 50 or 60 tests that we were able to do last weekend, and now we have the ability to do closer to 200. So we've really, as our lab anticipated, tripled that capacity. So I think the plans are still continuing. They're still waiting for some of the final equipment and testing to arrive in. So right now, we're pleased with some additional help from the QE2 in Halifax. Our turnaround time has really is good, and we have the assistance, of course, from the National Microbiology Lab. So with all those areas, I feel like we're in a much better position than we were 2 weeks ago, and we'll continue to increase that local testing capacity. We want to make sure we have enough local tests, of course, to run them really quickly, and we want to always make sure there are tests kept available so that if there was a long-term care outbreak, for instance, we would be able to do those rapid tests very, very quickly here on Prince Edward Island.
Okay, thank you.
Laurent Rigaud, La Voix acadienne.
Yes, I have a question for Marion Dowling. We talked about a lot about the ventilators, but I'd like just to know how many ICU beds you have in the hospital right now.
We normally have 17 ICU beds within Health P.E.I., and they're located both at the Prince County Hospital and the Queen Elizabeth Hospital. In our surge capacity planning, though, with our pandemic plan, we have identified the ability to provide upwards of 40 ICU beds if that was necessary.
Okay, so just to follow up on that, there will be, when you will receive all the ventilators, there will be more ventilators than beds. Is that correct?
More ventilators than the beds in our capacity?
Yeah.
Yes, there would be, if you count all the ventilators that we have on order and that we know would be coming. We would have more than the spaces that we've identified so far. We do have another additional phase to our planning for additional surge capacity if it's necessary, and we haven't followed that planning through yet. Because we'll be looking at the numbers when they come out, and we've been just monitoring the situation, of course, being very fortunate to not have anyone admitted to hospital, let alone requiring critical care services to this point. So we're just monitoring that, but we do have the means to plan further and provide further capacity if necessary, but that's what we've got to date.
Thank you.
Wildenette Paul, Radio-Canada.
Bonjour, merci. Bonjour, la question est pour Dr. Morrison. Vous l'avez mentionné en anglais, mais j'aimerais avoir la réponse en français. À quel moment l'île du Prince-Édouard compte lever ces mesures? Parce que ça fait quelques jours là, que vous annoncez aucun nouveau cas. Est-ce que c'est en discussion? Est-ce qu'il y a une date? Donc, à quel moment vous comptez lever les mesures?
OK, je pense que j'ai compris. Dans quel temps est-ce qu'on veut enlever les mesures de santé publique ici à l'île du Prince-Édouard? Et puis, on est en train de discuter, on est en train de regarder les numéros ici à l'île du Prince-Édouard, mais aussi partout au pays. On ne veut pas les enlever tout en même temps. On ne veut pas les enlever trop tôt, parce que si on fait ça et puis on voit un montant de cas, ça va être défier tout ce qu'on a déjà fait. Mais on est en train d'en parler en discussion avec les autres provinces et territoires. Mais on n'est pas sur l'autre côté vraiment encore, mais même si on n'est pas sur l'autre côté, on commence à penser. Et puis, je pense que c'est important pour les gens de penser aussi que ça va changer à un moment donné.
Puis, avec l'arrivée de Pâques, c'est demain Pâques, est-ce que vous comptez mettre plus de contrôle des policiers? Est-ce que ça va être supplémentaire, ces contrôles-là?
On va avoir plus de gens avec les Ground Search and Rescue aux parcs provinciaux. Et puis, on sait aussi que les policiers de la ville de Charlottetown, ils vont aussi faire plus de présence au parc pour indiquer aux gens qu'il faut garder la distance physique. Mais c'est vraiment pour l'éducation, de continuer ce message alors de continuer ça. Et puis les policiers, l'enforcement est encore là et les officiaux de santé publique sont encore à l'aéroport et au pont, et ça va continuer pendant le week-end aussi.
Dernière pour vous, est-ce que c'est toujours 17 personnes qui sont rétablies ou il y a d'autres personnes qui sont guéries après avoir eu la maladie?
C'est encore 17 aujourd'hui, mais je peux avoir un update lundi quand on sera ici la prochaine fois.
Merci beaucoup.
Merci beaucoup. Those last couple of questions were in French. I know I've been asked to try to translate them. They're actually things that I forgot to say in French, really, and that I mentioned in English about the recovered cases, about the ground search and rescue, being out at the parks. Those were the questions I was trying to answer in French. Just, I think, to note that the intention is to come back on Monday, and happy Easter to everyone.